Well, greetings again, and we're going to still be on impacted teeth, and this is number 7. I've got probably 30 or 40 cases that were worth looking at, but I'm not going to show you all of them. But anyway, we'll see what we do on this particular case. And usually they have several other problems along with them as they go. So let's get started on this young lady. And I'll see if I got her going here. All right, this is, we started out in 1984, and she had baby teeth here, and so we're going to have to remove the baby teeth, and we take out some bicuspids underneath there. So we're reducing the number of teeth that she has because she's got a little excess height to the face and the fullness in the face. So we'll reduce that down some. So here we have her lined up like that, and these impacted teeth are way up here, so we'll get these out, slide this back, and bring that down in that place. So you look at her face here, and her teeth are bulged out, too much fullness in here, and this needs to be shortened in here. So we take the teeth away, and that'll put the same pressure on fewer teeth, and we could get the vertical height to close to some extent. Usually you can't close it all the way that way, but that helps out. Over a period of time, it will reduce to some extent. So let's see what we did. And now when she got too much of that and she smiles, you don't notice that very much. So if your face is too long down in here, just smile more often, and people don't see it like that. And here you see this needs to be less to bring that up, so that this height in here is about equal there. So you see, we see the teeth were coming in here. I'll show that on the x-ray in a minute. So we're going to take these teeth out. Now, this is these are baby teeth. They're molars, the second molars, and we'll go in and take them out, and we're going to take this tooth out right here and bring this cuspid down in that spot. On the other side of the mouth now, the cuspid is over here, and the central and the lateral, we got to get this cuspid back in that position there to do it. And she's got wisdom teeth. All these teeth are in there. And if you need to reduce the height of the face, the lower third, you get the wisdom teeth out too, if it can help it. Now we got to change positions on that one and get it down in there. Now down on the bottom, this one was hung, so we're going to take the teeth out over here, if I remember correctly. So yes, what we did, yes, when we took the bicuspids on both sides of the mouth out, the second bias now, and that will still bring the face in here, and that'll put her chewing for a certain length of time. On, you'll have 4 teeth missing in here, and that'll help close this down some, and we may get room enough for the wisdom teeth to come in. So we take the bias out, this starts drifting forward. We had to go down and get one here, you see, and now close that space up, and she's chewing on fewer teeth during that period of time, if she swallows correctly and bites, she bites down when she swallows, that'll help reduce that height of the face too. So here we've got the space closed now, the teeth are in position, and they took those out. So she's got cuspids, but not in the first bite. The second bites are gone. And now we've got more room back here for wisdom teeth. Now, in some cases, a high angle case, we will eliminate the wisdom teeth because they'll come in here and open it up even further. And that'll help get it down. I'm not sure what we did right here, but we lined that up, got the teeth in place, and now we're closing that gap, and we're going to look here, hopefully, and see what we did with the vertical height of the face. Now we've got them pulled all the way around, the midline's on pretty good. And now this takes some time to do this now. So we close that space, so we're restoring the teeth. So we're missing the bicuspids. That's restorative dentistry again. So here it's 1987, and we've taken quite a time in doing the case. It's 87. Now the wisdom teeth have room, but I think we have an airway problem here with the adenoid tissue. So we send her, if I'm not mistaken, we send her into an ENT guy to get the adenoids out and open up the airway so she'd breathe through her nose, then she could close her teeth, and that helps lower this down. And we brought this back some, and if you wanted to do a genioplasty on this, you could take some out here and pull that up, and that would lower the facial height also. So here's the facial structure, and now at this time you don't see that fullness that she had when we started, and also this has gone down some. And here she is later on. This is looking perfectly normal now. See, so we got teeth out, we brought this down, we got her airway straightened up, she's breathing through her nose, and she swallows correctly, and that has returned part of the height of this is just a little bit more there, you don't even notice that. And that's what you want to do in cases like this. I'm sorry for that she smiles, but she closed her eyes when I got that picture. And now this vertical height is almost ideal. And it closed on its own by us correcting the airway and also reducing the teeth to get more pressure on the same teeth. And so this is an important thing to learn how to do. Now there the teeth are at 91, and they look great, and she does too. She dyed her hair. Maybe that helped her too. And the teeth are lined up, and that's the end of it. And I'm going to close it out.